Today, I'm going to discuss few question and answer for NCLEX licensing exam. This question and discussion help you to prepare and to get your license. The first question here, a nurse is performing a head and neck assessment on a client who report the fatigue. Identify the area that the nurse palpate to assessment the occipital lymph node of the head. So the picture look like here, this is the chain of lymph node. So you have to click which group of lymph node is called occipital lymph node, right? Like this is the preauricle, this is submandibular, subclavicular, but which one is the occiput? You have to click. So lymph node are a small structure, right? It is very small that works as a filter for harmful substance. They contain the immune cells that can help to fight infection by attacking and destroying the germs that are carried in through the lymph fluid. So this picture, you said this it is called occipital lymph node. So rationale, using the pair of the fingers, the nurse bilaterally palpate the area behind the ear to assess the occipital lymph node. In this picture, we can see what are the other lymph nodes. Anterior to the ear, it is called preauricle. Because it is the before auricle. After or post auricle, we call post auricular, and then occipital. These two groups lymph nodes called parotid because it is over the parotid glands. This one is called retrotonsillar lymph node, submandibular, submental, anterior cervical, distal posterior cervical, and supraclavicular. Examiner asking which one the occipital, this one. Next question. While assessment applied spine for abnormal curvature, the nurse note the lordosis. Identify the area of the spine that is affected by lordosis. So this is the spine, cervical area, thoracic area, lumbar, and sacrum. Lordosis, kyphosis, scoliosis are the spine curvature that can cause the pain or discomfort. So examiner asking, find out which it is the lordosis. The correct answer is lumbar spine, right? Lumbar area. So this is the normal spine, and this it is called cervical. This is thoracic, this lumbar, and pelvis. So lordosis is characterized by a accentuated curve of the lumbar area. So this is the lumbar area. So if lumbar area is curved too much, it is lordosis. As I told you, lordosis, kyphosis, or scoliosis are the spine curves that can cause the pain or discomfort. Lordosis is a natural curve in the neck or lower back, means lumbar or cervical. Kyphosis, it is the natural curve of the upper or mid back region, means thoracic area, right? Next picture here showing cervical curvature. It is lateral views. When you look at the spine laterally or from the side, you will see the several curvature like cervical curvature, thoracic curvature, lumbar curvature, and sacral curvature, right? So in the first picture showing kyphosis, second picture showing scoliosis, and third picture showing lordosis. So if you ask me, what are the difference between scoliosis and kyphosis? Whereas the scoliosis is defined as an abnormal curvature of the spine when viewed from the front, kyphosis is a forward rounding of the spine, and scoliosis most frequently affected the lower spine, you see, lower spine or lumbar spine, while the kyphosis usually affect the cervical spine and thoracic spine. And next question. A nurse is conducting a physical assessment on a adolescent who does not want her parents informed that she had an abortion in the past. Which statement best describes the information securely measure the nurse can implement in this situation? My patient is adolescent, but she does not like to disclose her history to the parents that she had an abortion before or she had a sexual transmitted infection before, right? This is the question about the privacy. This is the question about the emaciated minor, because my patient is adolescent, right? So number one said, respect the adolescent's wishes and maintain her confidentialities. Because the adolescent is a minor, inform her parents about the medical history. Number three, discouraging or discussing the adolescent's medical history with the parents and thoroughly document it is in medical records. Number four, before agreeing to maintain the confidentiality, determine whether the adolescent is an emaciated minor or not. The correct answer is respect the adolescent's wishes and also maintain her confidentialities. So as a healthcare provider, when we work in a hospital dealing with the patient, we have to keep it in mind to ethics of principle. One is called HIPPA, HIPAA. HIPAA stands for Health Insurance Portability and Accountability Act. HIPAA protects the confidentiality of a patient's healthcare information. It requires physicians, nurses, hospitals, and other healthcare providers to inform the client how their healthcare information is used and disclosed. My patient is adolescent, right? And my patient is emaciated minor. What does it mean? So a child is freed from parental custody and can become an adult in many ways. When a minor marries or joins in U.S. Armed Force, he or she becomes emaciated from her or his parents. So this girl is pregnant. So she's emaciated minor. She can take the decision on behalf of her choice. If she wants, she can continue the pregnancy, right? So she wants, don't disclose her history to the parents. So doctor or healthcare provider must follow her, respect her decisions. So the nurse should respect the rights of minor who do not want the parents informed of medical problems. She should not tell the parents about an adolescent's past procedure. Many states have a laws that emaciated minors for a healthcare visit involving pregnancy, abortion, and sexually transmitted disease. Next question. When palpating a client body to detect the temperature or warmth, the nurse should use which part of the hand, right? Fingertips, finger pad, dorsal surface, or ulnar surface? The correct answer is dorsal surface. So in this picture, we can see the back of the hand we call dorsal surface, and plumber of the surface we call ventral surface. Basically, in this picture, the healthcare provider feel the temperature of the patient by dorsal surface of the hand. What are the rationale? To palpate for the temperature, the nurse should use the back or dorsal surface, right? The fingertips are best for distinguishing texture and shape. The finger pad are the best for assessment hair texture, also grasping tissues, filling the lymph node enlargement or not, and also ulnar surface for filling the thrill or fremitus. Next question. A nurse is helping to plan a teaching session for a client who will be discharged with a colostomy. Which statement describes a healthy stomach? Number one, the stomach should appear dark and have a glow. Number two, At first, the stoma may bleed slightly, then touch. Number 2, 3, the stoma should remain swollen. Number 4, the bluish sensation under the stoma, right? So correct answer is, at first the stoma may bleed slightly when touched. So the keyword is here, the teaching session for a client who will be discharged with a colostomy. So what is colostomy? A surgical operation in which a place of the colon is diverted to an artificial opening in the abdominal wall, so as to bypass the damaged part of the colon. Let me show you. These are 3 types of ostomies. One is called colon ostomy. What is doing in the descending colon, terminal part. The other portion is called ileostomy, the last part of small gut, ileum. And also, if it is due in urinary system, which is called urostomy. So it is the surgical opening in which a piece of colon like this, go to the next picture, like here, a piece of colon is diverted to an artificial opening. Look like this, it is called stroma. Normal stroma look like, and here the stroma. And this is colostomy bags. Artificial opening in the abdominal wall so as to bypass the damaged part of the colon. So this one is a healthy stroma, and this is unhealthy. So ostomy care is important to know. Every healthcare provider or nurse have to know. During the stoma assessment, we have to check the stoma should be pink to red or and moist. The pallor or cyanosis or dark color indicate poor blood supply. Black indicate necrosis, so bad. And initially there may be some edema at the beginning. When we assessment for the stoma, sometimes we can see the ulceration or any abnormal findings. We could notify healthcare provider. Also, we should assessment the skin around the stoma. Also note any redness or irritations or necrosis. So they said the correct answer, at first the stoma may bleed slightly when touched. What is the rationale? The surgical site remains fresh for up to 1 week after a colostomy, and touching the stoma normally causes slightly bleeding. However, profuse bleeding should be reported immediately. A dark stoma with a blue hues indicate impaired circulation. A normal stoma should appear red, slightly to the look like buccal mucosa. Swelling should decrease in 6 weeks, and leaving a stoma that protrude slightly from the abdomen and continued swelling suggests a blockage. A burning sensation under the face plate is abnormal and indicate the skin breakdown. Next question. A nurse must assess a client's splinted extremity for neurovascular damage. So which should she do? So neurovascular damage. So when you neurovascular assessment, you have to overview something, right? First one, assess the client extremity, ensuring that the extremity with the splint feels colors, then unsplinted extremity. Move the client finger or toes to test movement. Evaluating each extremity capillary refill, making sure it's the same both sides or bilaterally. Number 4, be aware that edema and pulse checks are not part of the neurovascular assessment. This examiner asking what should she does or should do. The correct answer is evaluate each extremity's capillary refill, making sure it is the same bilaterally, right? So during the complete neurovascular assessment, the nurse should compare the client extremities. For example, compare the capillary refill of each extremities, which should be the same both sides or bilaterally. Extremities should be equal in both sides, temperature should be equal. The nurse should assess movement by having the client move the tip on fingers and toes. Edema and pulse checks are the part of neurovascular assessment. Let me talk something more. When we go neurovascular assessment, we check the pulses. We check radial pulse, dorsalis pedis pulse, posterior tibialis should be assessed and also grade noted. Again, we compare in the both sides, both legs. We check the color. We check the sensation. So neurovascular assessment, easy way to remember, 5 P's means we check for pain. So when you touch, if patient complain the pain, it is good to write down. We check the pulses like dorsalis pedis, posterior tibial, and also we check for the color. So the fingers or toes should be normal skin tone. Any deviation from this suggestive of an inadequate blood flow, we call pallor. Also, we check for sensation like paresthesia and paralysis. So can you feel this? So when you touch with a cotton or a pin, ask, can you feel it? If patient say no, means paresthesia. What is paresthesia? Tingling sensation or sensation of the numbness result from nerve compression. So sensation, there should be normal sensation. Numbness or tingling or paresthesia are not normal. Also, we check, can you move the tip of the finger? If patient do, it is good. If patient do not do, means paralysis. What is paralysis? Left side of the compartment syndrome, which result from prolonged nerve compression or muscles damage. This present inability to move the limbs. Next question here. A nurse performing a preoperative assessment, which client statement should alert her to the presence of risk factors for post-operative complication. Number one, I have not been able to eat anything solid for past 2 days. Number two, I have had surgery before. Number three, I had an operation 2 years ago, and I do not want to have another one. Number four, I have cut my smoking down from 2 packs to 1 pack per day. So examiner asking which client statement should alert her to the presence of the risk factors for post-operative complication. The correct answer is, I have cut my smoking down. But patient should stop the complete cessation of the smoking, right? The rationale: smoking 1 pack of cigarette per day reduce the activities of the cilia lining the respiratory tract, increasing the client risk for ineffective airway clearance after surgical operation. Lack of solid food for 2 days before surgery, or no history of the previous surgery or any anxiety about surgery would not increase the risk of post-operative complication. But still smoking can. So it is good to be stopped. Next question. When assessing an elderly client, the nurse expected to find various age-related physiological changes. These changes include: number one, increase the coronary artery blood flow, decrease posterior thoracic curve, and decrease the peripheral resistance. Number four, delay gastric emptying. So physiological change occurs with aging. In all, it is very natural. Because of aging, physiological change occur in all organ systems, like cardiac output should be reduced, blood pressure increase, atherosclerotic change. Also, the lungs show impaired gas exchanges, decrease the vital capacity, and slow respiratory flow rate. Also, GIT reduce its activity or peristalsis, right? What are the correct answer? Delay gastric emptying. So age-related physiological change include delay gastric emptying, decrease coronary artery blood flow, increase the posterior thoracic curvature, increase the peripheral resistance. In this picture, we can see neurological change. Our brain volume should be decreased, cerebral blood flow decrease, number of synapses decrease, and working memory should be decreased. In case of cardiac system, we can see the left ventricle wall thickness increase, left atrial size should be increased, but end diastolic volume should be decreased, myocyte hypertrophy occur. Also, number of cardiomyocytes should be decreased. Fibrosis is common, or arteriosclerosis develop. In case of renal, glomerulofiltration rate should be down. Increase the glomerulosclerosis, interstitial fibrosis occur, tubular atrophy, also arteriosclerosis, decrease the number of nephron. In case of respiratory system, the lungs show impaired gas exchange, decrease the vital capacity, slow the expiratory flow rate, decrease alveolar surface area, decrease diffusion capacity, increase alveolar arterial gas, decrease the vital force capacity, airway clearance. Musculoskeletal, decrease the muscle mass, decrease muscle quality, increase myosterosis, increase the chance of fracture. So this is all physiological change occurs with aging in our organ systems. Here showing the normal chest wall, but here increase the stiffness of chest wall. Myocyte clearance should be more clear, but here reduce the mucociliary clearance, decrease elasticity of the lungs. Here enlarge the alveolar duct and alveoli, so retention occur. Next question. What are the common source of airway obstruction in an unconscious client? A foreign object, saliva or mucus, tongue fall, and edema develop. The correct answer is the tongue go back and fall causes obstruction. So rationale. In an unconscious client, the muscle controlling the tongue commonly relax, causing the tongue to obstruct the airway. When this situation occurs, the nurse should use the head tilt, chin up or left maneuver to cause the tongue to fall back into place. So in first picture, we can see block the airway because of tongue, right? This is one. But when you chin is up or chin left head tilt, it can prevent the tongue fall and causes the obstruction. If she suspects the client has a neck injury, she must perform jaw trash maneuver. Next question. A client with a fever, weight loss, watery diarrhea is being admitted to the facilities. While assessing the client, the nurse inspected the client's abdomen and noticed that is slightly concave. Additional assessment should proceed in what order? So what is the order of assessment for the abdomen? Number one, auscultation, percussion, and palpate. Number two, palpate, percussion, auscultation. Number three, percussion, palpation, auscultation. Number four, palpate, auscultate, and percuss. As I told you, physical assessment, particularly for abdomen, palpation is last. So which one palpation is last? Only here. auscultate percussion, but palpation is last only number one, right? Answer is auscultate, percussion, and palpate. So rationale, the correct order of assessment for examining the abdomen, we go for inspect, then auscultate, then percussion, and palpate. The reason for this approach is that the nurse should perform less intrusive techniques before the more intrusive techniques. Percussion and palpate can alter natural findings during auscultation. So patient assessment remain the most important means to detect the abdominal trauma. So major purpose of the abdomen exam is to get more information that could indicate what is causing the patient's symptoms. So assessment also know in what order to do auscultate vowel sound, right? We have to know. So 4 steps, abdomen exam, particularly inspect, auscultate, percussion, and palpate. So basically during the physical assessment, any system and abdomen sequence is not same. Like example, you are going to go assessment of the intragumental systems or the skin or lungs. First of all, inspection, palpate, percussion, and auscultation. In case of abdomen, the sequence should be inspect first, like this, but second is auscultate, third one percussion, and palpate. The next question is here. A 10-year-old child with a rheumatic fever and must have this child his heart rate measured while he is awake and while he is sleeping. Why are the 2 readings? So my client is a 10-year-old rheumatic fever, right? So why I need to check during sleeping and during waking? Number 1, to obtain the heart rate that is not affected by medication, to eliminate the interference from the jerky movement of chorea, to ensure that the child cannot consciously raise or lower his heart rate. Number 4, to compensate the activity's effect on child heart rate. Compare and contrast. The correct answer, the compensate the activity during sleeping and during awake or activity when is more. So my patient has a rheumatic fever. So rheumatic fever is an inflammatory condition that may develop after infection with, so rheumatic fever, you can see it is inflammation condition that may develop after infection with group A. Group A, Streptococcus pharyngitis caused by Streptococcus pyogenes or bacteria. So such as the Streptococcus throat or scarlet fever. And it is primarily diagnosed in the children between the age 6 to 16 and can affect our heart, we call myocarditis, can affect our joint, and it is migratory polyarthritis or can affect our nervous system, we call chorea, abnormal movement of the limb, and also can affect the skin, subcutaneous nodules, and erythema marginatum. So like this, these children has a erythema marginatum. Skin get involved in case of rheumatic fever. So what is the rationale? Tachycardia may be a sign of heart failure. The nurse can detect mild tachycardia more easily when the child is asleep and when he is awake, because of activity can increase the heart rate. Medication given for rheumatic fever and rheumatic heart disease, such as digoxin, also exert their influence both day and night. Chorea is symptoms of rheumatic fever and is the loss of voluntary muscle control. It does not affect the pulse because the child would not be sitting quietly while the nurse measures his heart rate and would not be involved in purposeful movement. A 10-year-old child probably does not know how to consciously raise or lower his heart rate. Next question here, a nurse is obtaining health history of a client, those background different from her own, to develop the culturally acceptable strategies for nursing care. The nurse should assess which client factors, marital, cultural, financial, and also community involvements. We will take all of the history, but which one is the priorities? Cultural influence. So assessment, the client cultural influence helps the nurse identify behaviors she should take into account when planning his care. Although the nurse also must consider the client's marital status, financial resources, also community involvement when planning care and rehabilitation. These factors have a little relevance when she is formulating culturally acceptable strategies for nursing care. Next question here. A nurse can auscultate for heart sound or more easily if the client is supine or if the client on his right side, if holding his breath or leaning forward. So which position you will get best heart sound? Answer is leaning forward. So the nurse can best auscultate for heart sound by asking the client to lean forward and also exhale forcefully. This position enables the nurse to listen for heart sound without the sound of expirations interfering. Using the supine position to visually inspect the precordium, also allowing the nurse to observe the chest wall for movement, for pulsations, and exaggerated lift or strong outward thrust over the chest during the systole. Placing the client in a left lateral decubitus position may make it easy for the nurse to hear low-pitch sound related to arterioventricular valve problems. Next question here. A nurse is conducting a physical assessment on an of its 17 years old who has asked for information about the gastric bypass surgery. Which statement best described about the informed consent as it applied to this situation? So informed consent. So this must be obtained from a client or their healthcare proxy for any invasive procedure. Because this patient about the gastric bypass surgery, it is obtained by the healthcare provider like physician, while the nurse roles is to ensure that consent is signed and also in the chart prior to the procedure. So there are four options. What should be the answer? Providing adolescents with information about the procedure and implies informed consent. Number two, the nurse should inform the adolescents that he may sign a consent form for a surgical procedure if the parents who sign the form. Patient is 17 years old. Number three, the nurse should inform the adolescents that the most state only parents may give consent for minor medical care. Number four, the nurse may provide adolescents' legal guardian with information regarding the procedure. The correct answer is the nurse should inform the adolescents that the most states the only parents may give consent for minor medical care. So my patient is a 17 years old, right? Is a minor. So informed consent we can take from the parent.